As you walked into this classroom, you may be wondering, why should I care about the nervous system? Throughout this class, you will learn many of the 1,000 disorders of the brain and nervous system. Astoundingly, almost 1 in 3 people will have a neurological disorder in their lifetime. People with neurological disorders make up more hospitalizations than any other disease group and cost Americans $800 billion annually. Neurological disorders are the leading cause of disability and the second leading cause of death worldwide,
including stroke, migraine, multiple sclerosis, Alzheimer's and dementia, Parkinson's disease, and meningitis.
My name is Carlos Esteves. I'm a medical doctor, now retired, after practicing cardiology for 40 years. I was born in Cuba, and I knew that I wanted to be a doctor way when I was in grade school in the 4th grade. The nervous system affects every organ system of the body, and as such, it's important to have a full knowledge of the function of the nervous system, because no matter what your specialty is, you will have to deal with organs that are affected by the nervous system.
¿Cómo te llamas?
Margarita,
¿Y dónde está?
en el hospital.
1 in 3 seniors dies with a form of dementia, and disparities between racial and ethnic groups for Alzheimer's and dementia are devastating. Looking to the future, the numbers look to only be getting worse. The cost of care is projected to increase to $1.1 trillion by 2050.
¿Y por qué está en el hospital?
Porque me están experimentando.
¿Y qué dicen los médicos?
No, it's nothing, it's just, I think I failed or something, that's why.
And how about your memory?
No, my memory's getting bad.
Hi, my name is Ann Wynn. I am the primary caretaker of 4 people in my family, my grandparents, my younger brother, and my dad. When I was in undergrad, my mother experienced a hemorrhagic stroke 6 months to the day after my dad experienced an ischemic stroke.
Nearly 800,000 people in the U.S. have a new or recurrent stroke each year. Subsequently, strokes account for 1 in every 20 deaths in the United States. For the people who survive, strokes are a leading cause of serious long-term disability. 80% of strokes are preventable.
My mother was not even 50 when she had her stroke. It was terrifying, to be honest, because you look at a woman who, for all intents and purposes, besides a mild case of high blood pressure, was very healthy, and yet she still had a stroke and was gone in a couple of hours. When it comes to my dad with his ischemic stroke, it was a really different story. It wasn't until a year and a half after he first got his stroke that we were finally approved for disability, and he was finally able to get a short time of physical therapy paid for in full, which I think really changed the course of his recovery.
My name is Lauren, and I live in Colorado. I am a teacher. This is my 8th year of teaching, and I've had migraines since I was 7.
Migraines are debilitating, and they affect roughly 1 out of every 6 Americans in a 3-month period.
Women
And people of low socioeconomic impact are disproportionately affected. Migraines account for the 5th most common reason for a visit to the ER.
For me, my symptoms are so severe when I get a migraine that I literally can't do anything but try to recover. And so if I'm at work and I get a migraine, we have to call in a sub to come and cover my class, and then I have to have somebody come and pick me up from work, because what I have to take currently is I take 4 ibuprofen, 1 to 2 Benadryl, a Percocet, and a Phenergan for my stomach. And then occasionally it'll be severe enough that I'll have to take a second Percocet. Sometimes I'll be teaching and all of a sudden my vision will just start to be disrupted, and that's when I know something's wrong. I can't read out my textbook anymore, and that's usually when I have to contact someone to come in and cover it. But sometimes if it's the more severe ones, I even will get impairment when it comes to thinking and even being able to recall basic facts. I've had ones that are so severe that I couldn't tell you my birthday or what date it is, because mine really mimic those stroke symptoms. And so I'll have part of my body go numb, sometimes my arms or my hands will go numb, my mouth will go numb, so it makes it hard to talk. And then the next day, it's better, but it's the migraine hangover. And so I'm taking ibuprofen all day. I'm a little bit nauseated all the next day, but I'm able to function.
Approximately 2 years ago, I was diagnosed with Parkinson's disease. One of the first symptoms that I had was difficulty with my balance and equilibrium. Dopamine affects the motility of the gastrointestinal system. As a result, everything slows down and you develop constipation. It also affects your swallowing, which can lead to aspiration, which can lead to pneumonia. It affects your vocal cord. For example, I'm a little bit hoarse when I talk. It also has some emotional issues such as depression, apathy, cognitive dysfunction, which can lead to dementia. Unfortunately, there's no cure for Parkinson's, but there's a lot of things that you can do to maintain, to remain functional. For example, a speech therapist, you're maintaining your voice. Another form of exercise is boxing. So I take boxing lessons 3 times a week.
I have gone to an urgent care before where there was a doctor there that just had no experience with migraines, and he was just speaking so loudly, was getting frustrated if I was slow to answer a question, but I'm like, I'm trying to remember my name right now. It was horrible. It was an awful experience, but luckily one of his nurses was more familiar and so compassionate. And so when she came in, she turned off half the lights for me. She was speaking really low and quiet, and that was just so appreciated. Just the care and just the acknowledgement that this is real pain. The pain gets so severe sometimes where you're desperate for it to be over. So just having that sensitivity and just acknowledging the urgency with which that person wants that pain to be done. So being able to quickly move to a treatment plan is really appreciated too.
Pensar bien y portarse bien y seguir las reglas de la cosa. Que estudien, que se porten bien y que pa'lante.
I guess my advice to each and every one of you is to understand that when you learn all the pathology and you are so proud of yourself and patting yourself on the back for your differentials, don't forget that there's a human behind that differential. And there's a human with all their complexities and their entire social network behind that diagnosis. You can have the same patient in adjacent rooms with the same diagnosis, yet they need entirely different things.
The most rewarding aspect of being a doctor is being able to help people with their health, things that they need the most.
As you can see, you don't have to be a neurologist or a neurosurgeon to recognize why you should care about the nervous system. Unlike some other body systems, the nervous system is foundational and ubiquitous. And because this field is so vast, there is a lot that is still unknown, especially about some disease processes. So many aspects of neuroscience research and care are cutting edge. So buckle in, this is going to be an amazing journey as we learn about the nervous system.